Today we are here to celebrate transit in Kansas.
And in certainly many cases, transit is the only way to maintain the health and vitality of the members of the community, whether through transportation to work, to health care, or a way to get somewhere, even sometimes on the weekend for fun. KDOT supports around 145 transit providers throughout the state, covering almost every county in the state of Kansas, and serves everyone from the elderly to people with disabilities and also the general public. The public transportation program has grown significantly over the last decade. In 2017, as Susan mentioned, we had 10.1 million rides throughout the state of Kansas. 7.6 million of those were in the urban areas. 2.5 million were in our very rural areas. Transit and paratransit are here to serve the people of Kansas, no matter what their age or their ability.
Public transit is also an avenue to jobs and employment centers. From teenagers going to their after school to medical staff working at VA hospitals, transit is a reliable contributor to Kansas. Public transit not only opens up opportunities for those without their own vehicles while saving them money compared to the cost of owning a vehicle, it is also a reliable contributor in getting Kansas to and from work quickly and efficiently.
The fact that public transportation and paratransit services are available makes it possible for a patient to get to therapy such as dialysis or maybe a medical appointment for a chronic illness, and they don't have to have a family member or a friend drive them there. One of the studies, and here's where I'm going to refer to that 65, one of those studies of Americans 65 and older showed that non-drivers take 15% fewer trips to the doctor, 59% fewer trips to shop and to eat out. But the one that shocks me the most is 65% of them take fewer trips for social and family activities compared to those that have a vehicle that they can travel in. Now, these trips would otherwise be impossible for these non-drivers, and this highlights how transit contributes greatly to the health, well-being, and the quality of life of people.
Yeah, we're a small urban and we've got these big buses, but the majority of this state has these small little buses going up and down country roads, back highways, and they are taking people to these medical appointments or connecting them to go get groceries, whatever it is. It is what we need in each and every county to keep every county vital. It's paramount. If these people cannot access services, cannot access goods, if they're isolated, then it is a sad story.